Welcome to another insightful episode on Acute Insights, where we delve into the fascinating world of psychology. Acute Insights is your reliable platform, dedicated to providing engaging and educational content on psychology. Our aim is to illuminate the intricacies of various psychological disorders, facilitating a better understanding and fostering empathy for those grappling with these conditions. Today, we dive into a topic that affects many yet remains misunderstood: acute stress disorder. Imagine walking down a quiet street when suddenly a car comes screeching around the corner, heading straight towards you. In the blink of an eye, your peaceful day is shattered, replaced by a heart-stopping moment of terror. This moment is a glimpse into the world of acute stress disorder, a psychological response to a traumatic event. Just as our person on the street experienced a sudden life-threatening event, acute stress disorder can be triggered by a variety of traumas. These can range from personally experiencing or witnessing a severe accident to being confronted with an event that involves actual or threatened death or serious injury. The human mind is a resilient organ, but it's not impervious to such shocks. When faced with an overwhelming event, it may react by developing acute stress disorder. This is not a sign of weakness, but rather an indication of the mind's struggle to cope with a traumatic experience. In our story, the person might develop acute stress disorder as a response to this traumatic event. Our character, after the incident, starts to behave differently. He finds himself reliving the traumatic event over and over again. This isn't just a simple replay in his mind, it's as vivid and intense as the original experience, making it feel like he's going through the trauma all over again. Furthermore, he develops an intense aversion to anything that reminds him of the incident. This avoidance extends to places, people, and even conversations that might trigger memories of the event. His mood begins to fluctuate wildly, from intense irritability to sudden bouts of sadness. He may feel jumpy, always on edge, a symptom known as hyperarousal. Sleep becomes elusive, concentration wanes, and he is constantly on guard, anticipating danger at every turn. These symptoms aren't just fleeting discomforts, they disrupt his daily life, affecting his work, relationships, and even his sense of self. Our character struggles with these symptoms for several days, indicating the presence of acute stress disorder. Recognizing these symptoms, our character seeks help. The journey to recovery often starts with understanding that help is available and accessible. For acute stress disorder, a common treatment is cognitive behavioral therapy, or CBT. This form of therapy helps patients learn to change potentially harmful thought patterns that could be contributing to their stress. It's a hands-on approach, providing patients with a set of skills to manage their stress effectively. Another treatment option is eye movement desensitization and reprocessing, also known as EMDR. This therapy is particularly effective for those who've experienced traumatic events. It works by helping patients process and make sense of their trauma, reducing its impact on their mental health. Medication can also be used in conjunction with therapy, particularly for those experiencing severe symptoms. The appropriate medication will depend on the individual's specific symptoms and overall health. With the right help and support, our character begins to regain control over their life. Acute stress disorder, a response to a traumatic event, can be distressing and disruptive. We've discovered its root causes, ranging from life-threatening incidents to deeply distressing experiences. We've identified its symptoms, including severe anxiety, disconnection, and recurring nightmares. Importantly, we've also explored various treatment options, from cognitive behavioral therapy to medication. By recognizing these elements, we can better empathize with and support those affected. Thank you for joining us on Acute Insights. Remember, understanding is the first step towards compassion. Until next time, keep exploring the human mind.